Okay, good evening, guys. I have discussion C for you. We're discussing the phases at the end of life so that people understand the whole process. So here we go with today's C for you. Likely meaning of the phrase. The phrase is, guys, the phrase most likely refers to death rattle or the agonal breathing sounds. These are characteristic respiratory sounds clinicians use as one sign that death is approaching. Okay, what is it? What is the death rattle? What the death rattle is? Definition: a noisy gurgling, rattling sound caused by pooled secretions in the upper airway when a dying person can no longer clear them themselves. Physiologically, loss of effective cough and swallow reflexes, plus decreased consciousness, allow saliva and bronchial secretions to collect in the pharynx and trachea, producing turbulent airflow, and the characteristic sound. How clinicians interpret it. Prognostic meaning: the death rattle is a clinical indicator that death is likely imminent, often within hours to a few days, depending on overall condition and other signs. Not a sole predictor. It is one of several bedside signs, e.g., decreased consciousness, molting, decreased urine output, Cheyenne strokes, which are, guys, that is when someone loses control of their body, control of arms, legs, things of that nature. So, okay, or agonal breathing, used together to assess imminence of death. Differences from agonal gaps or gasp. Death rattle, noisy secretions during passive breathing usually indicates imminent dying, but not the immediate moment of cardiac arrest. Agonal gaps, irregular, infrequent gasping breaths often occur during the final minutes of cardiac arrest and signal immediate circulatory collapse. Clinical management and family communication. Comfort focused care. Treatment prioritize Treatment prioritizes comfort, not prolongation of dying. Interventions may include postponing, repositioning, gentle oral suctioning, and anticoagulant medications to reduce secretions when appropriate. Limitations of interventions. Suctioning often provides only transient relief and can distress the patient. Medications can reduce noise but take time to act. Communication. Clinicians should explain to families that the sounds is common, usually not painful for the patient, and a sign that the body is shutting down. Offer supportive presence and practical steps to reduce noise if desired. Okay, key takeaways, guys. A distinctive gurgling or gasping sound near the end of life. An important bedside clue that death is approaching. Clinicians use it alongside other signs to judge timing, focus on comfort measures, and prepare and support family members. Okay, guys, so that is C for you. I'll be back on with D in a few minutes. For now, Gator Wellness, take care, folks.